Hello, everyone. In this revision lesson today, let's discuss the diagnostic criteria for obsessive compulsive disorder. The diagnostic criteria for obsessive compulsive disorder. To be able to help you with this revision, I have picked up this paper from May June 2024, variant 3.3. And of course, we are catering to section A, that is clinical psychology. Remember, in paper 3, question number 1, 2, 3, and 4, they're all based on clinical psychology. And if clinical psychology is the component that you have prepared for, you should know that these are the 4 questions that you'd be expected to answer. And starting off with question number 1 here, let's read this out. And once we're done reading this, we discuss the diagnostic criteria. So to begin with, Sarah is always thinking about germs. So we're talking about this lady with the name Sarah. She's always thinking about germs, perhaps germ contamination. At work, she eats lunch alone as she believes that this will protect her colleagues. So we are talking about a thought process, perhaps an irrational thought process, that if you do not eat your lunch alone, or if you have someone with you while you're having your lunch, this might transfer your germs to that particular person. So at work, she eats lunch alone as she believes that this will protect her colleagues. So this is an irrational thought that this lady over here carries. Moving on, she always washes her hands for 15 minutes in very hot water. So spending 15 minutes to wash hands in a very ritualistic manner. Remember, very hot water. This is another piece of information that is hinting us towards OCD. She feels better after this. So, an act that helps us with neutralization, feeling better after that, right? So, an act, a compulsive act. But after 45 minutes, she wants to wash again, a compulsive. Now, this is hinting us towards obsession, this part. And this part is hinting us towards compulsions or compulsive act. When Sarah gets home, when Sarah gets home, she washes her clothes, shoes, and coat. One day, when Sarah had sat next to a colleague, she could not sleep that night as she was convinced that he would get ill. Again, an intrusive thought which led to her day to day functioning getting affected. Having a look at the question over here reads, explain how, we pick up another color, explain how Sarah meets the diagnostic criteria for obsessive compulsive disorder. Now, the purpose for this revision video is to help you with revising, like I said, the diagnostic criteria for obsessive compulsive disorder. The reason why I read this question was to help you in terms of how, after knowing the diagnostic criteria for a particular mental illness, you could put that knowledge to use to be able to answer a question in your CIs. So to begin with, having a look at the diagnostic criteria for diagnostic criteria for OCD from the ICD, where OCD is obsessive compulsive disorder and ICD is International Classification of Diseases, the 11th edition. Moving on, presence of persistent obsessions or compulsions. Number 1, remember your obsessions are your thoughts. Irrational, illogical, dangerous, persistent, intrusive thoughts. Your compulsions are acts that you get involved into that you use to neutralize those obsessional thoughts. So the acts you are involved into to be able to neutralize those intrusive thoughts, you refer to them as compulsions. Number 1. Number 2, obsessions are repetitive and persistent that are intrusive and unwanted. So they're repetitive and they're persistent thoughts. They're always there. Compulsions are repetitive behavior or rituals. Obsessions and compulsions are time consuming. Yes, we saw this in the case of Sarah. Insignificant distress or result in significant distress or impairment of personal, family, social, educational, occupational, or other important areas of functioning. Now, this I would strongly advise you pause this video over here, invest a minute, maybe invest two. If you have a notebook, just write this down, but learn it so that tomorrow if you come across something in your CIs, you can actually put it to use. It wouldn't take more than a minute. Now, moving on, if we talk about the guidance that has been provided to us by the Cambridge, before we could move on and discuss the example over here, 1 mark for reference to Sarah's obsession or beliefs, that is germs to be able to protect colleagues. Colleagues get ill. Remember, this was the question. Explain how Sarah meets the diagnostic criteria, right? So it's about Sarah. You need to be able to score a 4 on 4. You need to keep on linking the content, linking your knowledge on the diagnostic criteria of OCD with Sarah. Now, moving on, 1 max for reference to Sarah's compulsion, that is washing hands for 15 minutes, very hot water, washing clothing, shoes, etc. So 1 max mark for this, 1 max mark for this. I'll just Sarah's obsessions, Sarah's compulsions. 1 max for reference to persistence or time consuming, always thinking about, takes up to at least an hour a day, 15 minutes every 45 minutes. Here you go. And at the same time, 1 max for explaining why obsession is irrational. 1 mark for explaining that the compulsion acts to reduce anxiety created by the obsession. Remember when I'd used the word, it's an act that you use to be able to neutralize those intrusive thoughts. 2 max for reference to impairment in life, couldn't sleep, sitting alone at lunch. Allow reference to both ICD and DSM, even when after 2024, the CI, they've shifted from DSM to ICD, but this year at least they're allowing reference to both. Do not credit obsessions and compulsions on its own as in the question, because of course this has to do with Sarah. The response must identify both obsessions and compulsions from the stem to be awarded full marks. Having a quick look at the example over here. Now, you might as well, after we're done discussing this, you might as well pause this here and try writing this down. Try figuring out the amount of time you take to write this. Because remember, for a 4 mark question, you shouldn't be spending anything more than 6 minutes. Just see how much is enough to be able to score 4 on 4. Now, to begin with, Sarah fits the diagnostic criteria for OCD as she's experiencing obsessions and compulsions. One of her obsessions is thinking about germs. This is when you get the first mark. This is something Sarah thinks about frequently, so it is persistent. Hinting on persistence here. In addition, Sarah engages in compulsions, which include washing her hands for 15 minutes in very hot water. So you're specifically referring to Sarah's case here. Sarah's behavior is repetitive and or ritualistic. Example, 15 minutes of hand washing and or washing her clothing, shoes, and coat. When she washes her hand, she does feel better. However, her anxiety returns and she has to wash her hands again, which is time consuming and excessive. Just pick up any 4 points from here. Her obsession and compulsions are having a negative effect on her job as she's spending time washing her hands as well as feeling distressed with her thoughts about germs. She's also missing out on socializing with her colleagues at lunchtime as she has to sit alone because of her intrusive thoughts. The other negative effect she's experiencing is not being able to sleep at night if she accidentally touches someone. So look at the enormous amount of options. 1, 2, 3, 4, 5, 6, 7. Out of these 7 points, write down any 4, making sure you're not missing out on any point that you shouldn't be, because we've already discussed the guidance is provided by the Cambridge. Having a look at more, DSM-5 is credit worthy as well. Thank you, Cambridge, for allowing this. Presence of obsessions and or compulsions. Obsessions are recurrent, persistent thoughts that are intrusive or unwanted. Thoughts are neutralized with some other thought or action. Compulsions are repetitive behavior, mental acts that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. The compulsion is aimed at preventing or reducing anxiety. However, these behaviors are excessive. Obsessions and or compulsions are time consuming or cause significant distress or impairment in social, occupational, or other important areas of functioning. Now, for you, you might see not much of difference between the DSM guideline and the ICD guideline. So this, the one at the top is ICD, the one beneath is DSM. I will zoom over here. You might as well pause it here, read it thoroughly, and then I'd zoom in over here. You might as well pause this and read it thoroughly as well. So this was a quick little revision on the diagnostic criteria of OCD through the ICD-11 and DSM-5 both. I hope this has been helpful. Thank you.